So welcome to the training that we're going to do. It's the beginning of a series of training that we're hoping to do on dementia care. This is developed, and some of the information in the handout is developed by someone named Tifa Snow, who is an OT, and the approach is called Positive Approach to Care. The understanding is that if you understand what's going on with the brain, you'll understand some of the behaviors that are going on for our people with dementia, and then you'll be able to provide the right amount of care and support that they need so that they do well. So now this is what I'm trying to like. Okay, next. That didn't work. Okay. This worked a minute ago. Okay. So we're going to understand what the brain does. We're going to try to figure out what drives some of the behaviors. We're trying to begin to gain some skills and to learn that uh-ohs can lead to ahas as care partners. So your brain, what does it do? Your brain does everything that it's everything that you do. The way you move, the way you talk, the way you feel, the way you think, what you recall, what you plan, what you dream. It's all based up in, actually, which is a really weird thing when you do when you actually take apart a person's body and you hold a brain in your hand, you can do that. It's really strange. But everything, your identity is basically, runs through that brain. So it interprets your world and enables you to do and take part in the world. Okay, I did this before. And it was going when I was practicing before you guys got here. Okay. When we're talking about people with dementia, we're in a relationship, okay? So we're saying caregivers and care receivers is what we usually think of it as. But we want to think, and with this process, we want to start thinking of it as care partners. And what I want you to do, and this is why I was kind of like, I want you to pick, each person pair up with a person near you. So that there's two people. I need care, so you can reach over there. I need two people. Pick a person now. Pick up your partner. You got one? You got one? Oh, this reminds me of Jim. Okay, Vicki, you.
My partner.
And if I've got an odd, next person, they'll be wrong.
So I got stuff.
What I want you to think about is who's got. Put your hands with your partner. Touch hands with your partner.
I already did this.
Okay.
I'll be Lisa's.
Okay. All right. Well, all right.
I need a partner.
I'm gonna do something. What I want you to do is with your partner, I want you to put your hand up here. Okay.
Okay. Yesterday.
All right. So if it's a nice gentle thing, everything kind of is. Now one of you is going to decide you're going to be the caregiver. Who's the caregiver? You can be. One of you decide. You can be.
She's the nurse.
Okay. Caregiver, I want you to start to push towards your partner.
Who is pushing?
Just the caregiver is pushing. Okay. So what happens? You start to push back, right?
Yeah.
Okay. So what we're trying to figure out is the next. See that in the middle of the thing. We think of ourselves as helpers. We think of ourselves as the person that I'm going to help you do this. I'm going to help you get dressed. I'm going to help you eat. I'm going to help you remember what you're supposed to do. I'm going to help you. And we're helping and we're helping and we're helping and you're pushing in, like what basically our agenda. You have to be toileted because you're wet. You have to be changed. You have to eat because you're not eating. You have to go to bed now because of, you're tired. And, we're pushing what's our agenda, and we have to look at it from their point of view, what they're seeing, what they're responding. Because if we don't, we get pushback of all different kinds. So that's what we're learning to try to do, and to learn why they do what they do. Just, and why you can remember, why can't you do it before? Okay. So dementia, what is it? What is dementia? What do you think of dementia as?
Brain changes.
It's brain changes. Okay. So we know, and that's what we're really knowing. It's a chemical change and a structural change in the brain. So that's going to be a lot of pictures of brains today. The thing about it being a chemical change is like sometimes it works, things work and sometimes they don't work. Sometimes it's like a bad wiring in a light bulb, which is exactly kind of what it is. So it'll be bright one day and the next minute later it won't be working. And later eventually it goes out entirely. So sometimes people can do what they used to be able to do, and sometimes they can't. For the next day it changes. All right. Okay. Dementia does not always equal Alzheimer's, and that's what a lot of people think of it as. Like when they say, I have dementia, I have Alzheimer's, they're not exactly one and the same thing. And a lot of think of dementia as memory problems. Well, I'm aging and I have memory problems, but I don't think I have dementia yet, okay? So, memory problems, you know, I'm getting a little older, I might need to think a little harder to remember something, I might have to go around to find a word, I might forget something when I'm doing and come back. That's normal aging, that's not, you know, I have a little memory problem, but it's not dementia. So there's a little bit, you know, dementia is actually something pretty serious. And you can't have a little bit of dementia, like you can't be a little pregnant. Okay. Okay, so dementia equals brain failure. The person's brain is dying if they have dementia. If it's not a delirium where they have something going wrong because of a medical imbalance or medication or infection, if that can be reversed, it's not dementia. Though sometimes they're calling it temporary dementia. They're calling it, we used to call it delirium. You know, so, but basically, once it's really dementia, the brain. So 4 truths about it. At least 2 parts of the brain are dying. So you can have a stroke and have one part of your brain that's not working, but it's got 2 parts that are dying. It's chronic, it can't be fixed, it's progressive and will get worse, and in the end, it's terminal. Okay, so it's like, so you know, the hope that we'll fix them when they come here, people will be fixed and do better when they come here. They might be because their leg is broken, but not because of dementia. It's kind of good, okay. In this, like, when we talk about Alzheimer's, there are over 85 types of dementias, or dementia causes. So Alzheimer's is the one we think of the most as the most common. There is young onset. If you just saw that movie about Alice, you learned a little bit of young onset. Late life onset is where, you know, we start to see more of it, and after every 5 years, you get a greater percentage of having dementia after 85 or after 80. Vascular dementias are multi-infarcts, what we used to call hardening of the arteries. Lewy body, and it's important, we're not going to go over these a lot, but it's important to know that there are different kinds because different medications are appropriate for certain kind of dementias than are not for others. And certain kind of ways that people respond or have dementia, like in frontotemporal, you know, that they tend to lose the ability to speak. So you kind of want to know what it is. Lewy body dementia, there's certain medications that you would normally give to other people that you don't want to give to a person with Lewy body. So you want to start to know about it. Other dementias are, you know, genetic syndrome, that can be like from Downs. Metabolic problems, alcohol abuse, white matter diseases, depression can lead to it. Infections, Parkinson's, multiple head injuries, kind of like our returning vets, and traumatic brain injury, kind of boxing, football, soccer, where they do a lot of heading, can lead to dementia later. So, I didn't fix this up. When I asked Dina, 60% of our residents have this diagnosis currently, just about, and have diagnosis. Now, they might not have a diagnosis yet, they might be getting there, but they're not there yet. 1 in 10 people over age 65 will have a form of dementia by the time they're done. 1 in 5 families are dealing with dementia currently, okay? So this was kind of an interesting question. How many in this room have family members, neighbors, loved ones with dementia? Okay, all right, so we're not more typical. Our evening group is a little bit different. It was 100%. But in a family with dementia, if you have 5 families, you know, 5 people, you know, like 5 families with dementia, 4 will fall apart from the problems that cause dementia. That's why it's really important. It's not just here at work, it's everywhere. So, now I lost the okay. It changes everything over time. It's not something a person can control. It's not the same for every person. It is not mental illness. It is real, and it's very hard to deal with because you don't really know. It doesn't make sense. For me, the first person I really remember dealing with dementia was when I was an occupational therapy assistant student. Gentleman came into the clinic. He must have broken his hip, but he had dementia, and he was crying out for water. And nobody else was there. I was experienced enough that they could leave me in the clinic by myself. I didn't know what to do. He was NPO. He wasn't allowed water, so I couldn't just give him water. I couldn't tell him, oh, there's a reason you can't have water. He was in extreme pain. He was in a jerry chair, and there was nothing I could do. And I was, you know, I mean, we've all been there, here, you know, so what do you do when everything's all falling apart? And the thing that you want to know is that there are actual structural changes. So, when you look at pictures later on the brain, you can see some of the changes that have occurred in the brain. It kind of makes sense when you see what's going on. the cells are actually shrinking and dying as they go. And the cells are producing less and less of the chemicals that help them to work. Sometimes they can do very well, like I said before, like when a family member comes in, they can do really good, or they'll be really good in the morning, they're kind of terrible at night. So it's a chemical change, too. Why do I keep losing this? Okay, so this is an image of the brain, which is kind of really interesting to see. The one on the left is a normal PET scan of a brain. And they're measuring the amount of energy that these people are using when they're asked to answer a difficult question. And so when you see red, it's like a high energy, okay? There's a lot of energy being used. The next colors that goes down, you're going to go down to the yellow, then the blue, and then to the purple. There's really nothing left, okay? The thing that you're looking at is in the top of the brain, this is kind of like up in the top. This one is right through, cut through your head, it's through the top. This is kind of cut through your head in an angle, okay? So this is showing basically the cortex that shows how we're thinking. On the left, you see up in the top up there, there's a lot of red, okay? That's where you're making your decision, when you're thinking, your impulses, your thought control, your judgment, your ability to put things in sequence, your ability to start something, to stay focused. There are a lot of the things that develop late in life. That's kind of what that person's doing here. This person is early or Alzheimer's. That person, they may or may not show. People may or may not know that they have dementia, but it's starting to show up. If you look at the difference in the top between the person over there and the second person, this one, how much less of the red, of the sugar that's going, that's the sucrose or whatever that's in the brain is being used. How much less is there? This is late Alzheimer. So when you think about a person's ability to make choices, to make decisions, to say, I shouldn't be doing this, I shouldn't be, this isn't the right thing to do. See how much less is right there. And the same thing is also interesting to see that on that far side over here, you're going to see a difference between the left side of the brain and the right side of the brain. So we lose on the left side of the brain first, and it goes around to the right. So if you're looking about this, so this is the left side, see how much smaller it is, and there's like language understanding, comprehension, they're kind of based over here. On the right, there's, that's still strong. This one over here, this is an 18-month-old baby. Okay, so if you look at the difference in what you're seeing, this is still present here, ability to hear, still thinking, choices. Down here, on this one, it's going through, it's like you're looking at what's called the limbic system is based in this part. And I had trouble remembering that the other day, I was like frustrated. It's the part that focuses on our emotions. It's the part where we start to remember, like our memories are formed and stored, and are created so that they are stored. It's also the part of it that controls breathing, respiration, hunger, thirst, all those kind of things are all here. So over there, you can see these areas are pretty large and moving. Okay, it gets smaller and smaller. This person, this is the thrive to survive. See how much it's getting smaller? You see the differences? So what happens is as they age, as they go through it, and they lose all the abilities that you had. So the abilities you gain late in life, like in your 20s, it starts to go in reverse order. So a small child, a person with late onset dementia. Okay, so that's why they start to not want to eat. They don't know how they're thirsty. They don't know if they have to go to the bathroom. They don't know if they can eliminate. They don't know when they can sleep or when they're up and when they're down. That's why that's happening. Okay, so, all right. Maybe I'll stand back here. See if I can get this to do this. Because my little mouse doesn't work. All right. All right. This big brain on the left is the same. These are two guys who died at about the same age. Same size head. Like maybe I think in their 70s, 80s. The guy on the left, and they like both males, that's a normal, healthy brain. He died. He didn't die from something that was going to hit his brain. The brain on the right was affected by Alzheimer's dementia. See the spaces between the ridges, okay? See the up in the top where there's like a big space, like it comes down low? that's where your brain is processing vision, okay? So there's huge vision changes and all throughout the whole structure of the brain, there is loss, okay? They said by the time a person who has ends up dying from Alzheimer's dementia, which is, like I said, the most common, the brain is 1/3 of the size of what it was when they started, with all the cells and all the stuff that's there. So you think when a person's talking to you, like they're doing the best they have with what they got. That's really what we're trying to remember. Okay, and that's what I said, it's brain atrophy, the cells die within, abilities are lost. But with Alzheimer's, that's one of the things, it has a fairly predictable way of happening. The thing about it is you can have Alzheimer's and Lewy body. You can have 2 or 3 different kind of dementias in the same person. So you can't always say that everybody's got the same kind. But that is one of the things about Alzheimer's dementia. It kind of goes in a certain pattern. And again, they're still trying to do research and finding out more, but still autopsy is the best way to know if you have it. And if that's going to be the diagnosis. Okay, so vision change. See the circles up there? That's the changes in vision. Okay. Now vision is one of the first senses we have. Okay. Little kids have it from the first time they're looking up at their, looking at their mama. The first thing they see is like what using their eyes, trying to get that coordinated. The thing that we've talked a couple times is, I'm going to show you this. This is where we're going to have you do a little work. On the edges of vision, they tend to lose their peripheral vision. So we retain the area in front of us that we're curious, our curiosity vision. We lose the side that's peripheral vision. That's they say safety awareness. Like with your peripheral vision, you kind of know if something's coming. You know that something's out there, so you turn to look. So they kind of lose, that ability to focus out here. And it happens to us as we age, but not as fast and hard. So this is where you get to everybody go out like this. Fine, don't hit your partner. Okay, look straight ahead and start to bring your fingers forward and see where you wiggle. See them wiggle. Okay. So I'm here. Anybody 20s? People in their 20s are back here. Okay. They said normally, and it does creep in. But somebody's about 72. Yeah, it's about like this. You lose about 45 degrees from the back here. So what happens is if you go like this and you start to see like what I look forward, this is when I start to trip on things. Okay, I start to, I start to not be able to see something. I kind of, but as a younger person, I can correct and rebalance. But a person who's older can't. When you get to early dementia, you're going to come in this far. Okay, so come in this far. Okay, make a circle. Okay. So I can kind of see everything around. I can see where you're going. I can see there's other stuff going on, but this is what I can pay attention to. Okay, you get mid-state dementia. Now you're going to do this next stage. You're going to go like this. Okay. This is like she calls it Tifa calls it binocular vision. So I can kind of see what's going on around. I can see, and if I'm going like this, and with just a little bit of looking down, I can see what's on my plate. For dinner. Okay, I can see around, but I'm losing a lot of the stuff that comes around here. Where this becomes important is, especially when we get to mid-dementia, is this is what they can pay attention to. So if I come, now you're my victim. Go like this, okay? If I come in like this and I start talking to you, how much of me do you see?
Just immediate.
Yeah, just my face, like this. I'm filling up the whole field of vision. That's all she really sees. She doesn't see that I can get away from you, you're in my field of vision, you're kind of taking it up. That's why some people get really agitated. So remember we talked back about the limbic system? Part of that is like the fight, flight, fright. Fight, flight, I have to get that in the right order. Fright, fight, flight, okay? So, your ability to know that if I'm too close to your space, if I start hanging out like this, and I'm really like, I can make a person really uncomfortable if I get too close to them, because then you say, okay, back up, go away.
Space.
Go away. So, when we think about that ability to know like what's our comfort level, she might know me well enough to know that I'm okay and she won't push me away. But she has the ability to say, oh, I can use my judgment and I know she's not going to hurt me, and I do that. But for a person with dementia, they don't always understand what's going on. And so that's when you start to get people kind of pushing away, get angry when you're doing self-care or doing care for them. So, when you go back down, we go this real quick because I think this is real important. You start to hear this a lot. So you got that. So what we're going to try to do later on is a different approach to kind of help that doesn't have a problem. So the next one you get like into a little later, and then you're going to go down to binoculars. Okay? Now, look at your left. Okay. Look at me. Okay, can you do both at the same time?
No.
Nope. Neither can they. Okay, so what they can see is they can't see, like if you're at dinner, they can't see that, you know, like maybe they're not even paying attention to dinner because if they're looking at what's going on in the world because they're curious, they can't see their dinner. So they can look up, they can look down. Sometimes they get lost in the going back and forth between the two different things. Or I can see your cup, but I can't see my cup, so I'll reach across it and grab somebody else's food because I can see that. Okay. Now, close one eye and go the next one. Okay. One eye. Okay. Now, bend down, try to touch the floor. Okay. How does that feel? Weird. Do you feel like where it is and like it's hard to know exactly where it is? So that's an end stage. They're kind of like you can only use one, even if both eyes are open, they can only use one eye at a time. So they lose depth perception. So that's why people are like, see these people like reaching for the floor. They don't know if that's a hole in the floor because they can't tell if it's just a, you know, a shiny wet floor or, you know, so there's a lot of things that will happen, you know, because of that problem. That's a change because of changes in vision that drive a lot of behavior, a lot of activity. Behavior is communication. It's not really a behavior. It's communication.
That drives a lot of that startle reflex.
Exactly, because of, yeah. So if you're going, okay, so I'm gonna, if you go, do this, okay, and I come up here and I'm going, hello. Okay, she doesn't know what's happening, so then, okay, if I did that, somebody did that first, I'm like, I'm already nervous, who's gonna do the next? And the next person comes up and they try to help me. Nope, I'm wired up for sound more. So by the end of the day, you have people who are ready, like, and you didn't do it, the next person comes in and say, hi, you know, you're doing, and like, you get a reaction that's just way off what you'd expect, because you just came in to help. So that's what it does drive a lot of the things. And you have, so that's why we're gonna talk about ways to approach people. They're also slowing the process, they see things in the, you know, but they can still see you. So some people say, they can see me. Well, yeah, they can see it because they're looking at you. But over here, they're not gonna see that somebody's coming around, or there's an edge down here that I can trip over, or my walker's over here and I'm over here, because once it's out of there, it just doesn't exist anymore. So you start to see, like I said, you know, start hearing. Okay, I don't think I can move as much of this one. Okay. I had this really worked. Okay. Learning and memory. This is the hippocampus, and this is the part that we talk about is first usually affected by dementia. Okay. So this is the area where you start to remember things. Okay, where you take something that you do and you kind of put it into your long-term memory. All that white and gray are the cells where you know information is transferred from one to the other and where it's stored. And you see, look at the difference between that area that's circled in the hippocampus and what is left. Okay, so loss. They lose the, you know, like, you know, what I have for supper, immediate recall. They lose the ability to pay attention to certain information, which is what you have to do to remember it. You have to go over it again. Recent events and relationships. But they do keep those long-term memories. They do keep the ability to, now confabulation. What that is when somebody says, you know, you stole my wallet. I saw you steal it. I know it was there before. You're the one, you stole my wallet. And there's nothing you can tell me that's not going to change that memory. That someone says if they take a lie detector test, they will pass because it's true in the brain. So that's something that can happen. They fill the memory up with information to make it right because they know that they did. You know, the wallet may have been moved, and they may have moved it. They don't remember it, but the wallet was there. Now it's gone. So therefore, someone stole it, and it's you. Okay. They do keep emotional memories. So they may not remember what you said, what you did, but they'll remember how they felt. When you did it, they'll remember how they feel about you. So that's why the relationship and having a good relationship becomes really strong. They keep motor memories. They can walk, they can move, they can do things, right, for a long period of time. But, you know, why are they doing it? They can't always. Okay. Alrighty. Why is this like a sweet spot thing? Understanding language is a huge change. If you look at that big glob on the left, that's how what part of your brain processes language. What you hear, what you see, how you make language, how you produce language, words. Okay, and on the right you can see that that's, you know, really different. Okay, hearing on the top part doesn't change. Okay, not much. So when they say huh, you know, when you talk to them, it's not because they can't hear you. It's because they can't process the language of what you said. Early dementia, they lose 1 in every 4 words that you say. Okay, so if you think about comprehension, that's not good. Beyond that, it gets harder. And so dying isn't not going to do it because they can hear what you're saying, but they don't understand. They don't understand what, at all. So they can hear what you're saying, they understand that you're saying something, but they don't really understand what the words are. So they can't interpret words. They lose a lot of words. They get off target, but they do get your facial expression and your tone of voice, your body language, and they learn how to cover up really well. So when you say, "Oh, what's in it? Would you like a glass of water?" And you're going, "You're not thirsty, are you?" And then you go like this, and they'll go, "No," because you went no. They heard a language, they heard a question, but they'll answer that. And so they're trying. Maybe if I do this. Okay. Executive control center, emotions, behavior, judgment, reason. That's what we were saying, that it's your prefrontal cortex, it's the last to develop. No guys in here, I can't. Women develop it earlier, guys develop it later. Okay, that's why, young adults don't get to lease loan cars out or, rent cars until they're older, and why, guys have a little bit more trouble until they're 30. That's what they say. So that kind of develops later in guys. But again, that's your ability to say, what, I see your point of view. I can see that you're trying to help me. I can see that I can let you move my arm even though it hurts, because I see you're trying to help me. They lose that ability. They can't, they lose the ability to decide what behavior they're going to do, what judgment. Oh, you left your walker over there. Well, I feel like I'm walking. We're saying we need a walker. They don't see that problem with that. I figured something out. Okay. Sensory strip, motor strip. Those are big changes in that ability. That's that we're talking about between the two, how they communicate between the brain. That's huge changes there. Automatic speech. They remember rhythm, music, swear words, nasty words. Yep, you got those. Formal language. There's huge changes. So that's on the right and the bottom of the right. So that bottom left. That's why, the people who would never ever swear or would never ever say nasty words develop that ability, because it's actually a skill that they retain, and the rest of it kind of goes apart. So those of us who use the word problems now. We'll have
a cleaner mouth when we get older.
I don't think so. We lose that filter. We keep saying, we're older, we're giving up that filter, but we lose that filter, and they totally lose that filter.
I can't wait.
The stuff that we hold back, we can't do that anymore. They lose the awareness of where their body is in position, which is why they don't always, they tip over and don't always know where they're going. The ability to locate and express pain. So when we ask them, do you have pain, they can't tell us where it is. They know something's uncomfortable, but they can't tell you it's their left knee, because they lose the ability to figure it out where it is. And the awareness of feeling in most of their body. But this is an interesting piece for the people who do private self-care. 4 areas get to be more sensitive, can be. Any of these areas can get hypersensitive. And so those are the areas that we tend to lose sensation, but we keep sensation in our hands, our feet, which is why the podiatrist gets to be so interesting, I guess. Our mouth, which is where we do a lot of care with eating, oral, brushing teeth, and our genitals. And usually, so you can do in the front. So it's easier to do self-care from the back than it is from the front, because the front can be hypersensitive. Okay, but they still need sensations. They're still driven to get that sensation information. So they move when we don't want them to. They do, so they're moving all the time. Okay. Self-care changes. They lose the ability to initiate and terminate. This is really, and it's kind of a neat thing to do. So what I want you to do is this. Go like this with your hands. Go initiate, terminate, sequence. So they lose that ability to kind of go that way. Okay. Using tools. They lose the ability to use silverware. That's something we pick up. They use the ability to brush their teeth, to how to hold it. Okay. But they can still do the motion of brushing teeth, even though they might not be able to hold it. So we can give them assistance by we'll talk later about a hand under hand, where we're holding the tool and we're giving that, and they're participating. Okay. And we can give them cute activities. We can say, oh, do this, and then once they go, then they're able to go it. So we can give them the assistance to do that. Okay, language. Can't find the right words. That's what's happening to me now. Word salad. We've had some people lately who've dealt with that. Like the words are